Hi, my name is Kory. I'm a nursing student with CF in the ADN program. Today I'm going to perform trach care, which I do not need an order for. It's just a normal nursing intervention. I'm going to enter the room and wash my hands and introduce myself to the patient. I do want to check my patient identifiers and have him confirm with me name and date of birth. I'm going to explain the procedure, which he probably already knows if he's had trach before. I'm going to establish a distress signal and let him know that if at any time he needs me to take a break, stop, or he's having trouble breathing, to raise his left hand. I have the bed up to a working level for my height. I'm going to lay this straight down because it can get kind of messy. And I'm going to put on some non-sterile gloves. And remove my dressing. I'm going to look at the dressing and look at color, odor, amount, and type, and I would document that in my documentation when I'm done with the procedure. Now I'm ready to begin. Remove my non-sterile gloves. Open up my brand new trach care kit and place my sterile field. I'm going to place it shiny side down. And maintaining everything on 1 inch border. I have a bottle of normal saline that I used for an earlier procedure on this patient. It already has the time that it was opened and my initials and his patient information. It is less than 24 hours old, so I can use it. However, I must lip it before I use it. So I would lip it, and I'm going to pour some saline in each 3 parts. I have a brand new bottle of hydrogen peroxide that I'm going to use. When I'm done, I'm going to date and initial this. I'm going to pour that in my bigger container. It's going to be equal parts 50-50 of normal saline and of hydrogen peroxide. These are my sterile gloves. I'm going to set up my sterile field a little more, organize it. I'm going to go ahead and place my Q-tips in some normal saline to clean. Now I'm ready to begin. This is my sterile hand, this is my non-sterile hand now. I'm going to remove his oxygen and remove his cannula. I'm going to place it in the hydrogen peroxide and let it sit for about a minute Then I'm going to clean it. Inside and on the outside. Then I'm going to place it in normal saline to rinse. And I'm going to dry it with some pipettes. And some gauze, and replace this cannula. Sterile is now over. Now I'm going to want to clean around his trach. I'm going to clean from the midline to the outside. And I'm using normal saline on my Q-tips. I'm going to replace a new dressing. And I would also need to put on some new ties. I would go ahead and place the new ties, tie them in a knot, make sure they're secure, allowing at least 1 finger breadth between the ties and the patient's skin. Then I would remove the old ties. I clean up my mess, make the patient comfortable, put the bed in the lowest position with the call light, and ask if he needs anything, make sure everything's okay. Then I would wash my hands, and when I leave the room, I would document how the patient tolerated the procedure and also that color, odor, and amount and type that was on his dressing. Thank you.